What's going on, everybody? And today I'm going to talk about the issue of does finasteride um, increase estrogen in the body? And that's a very important question that I've been thinking about for a very long time, and it pertains to a lot of things in bodybuilding and even outside bodybuilding, for people that take finasteride for hair loss and the people that take it for things like prostate enlargement, as well as a lot of other things. So both finasteride and dutasteride inhibit the 5-alpha reductase inhibitor, which is responsible for converting testosterone to dihydrotestosterone by reducing the conversion of testosterone to DHT. These drugs increase the amount of testosterone available in the body, which seems counterintuitive, but they actually do. Both of them inhibit the 5-alpha reductase, and by doing that, by inhibiting the conversion of testosterone to dihydrotestosterone, they increase the amount of testosterone available in the body. With more testosterone available in the body and less converted to DHT, some of the excess testosterone can be aromatized, meaning converted to estrogen. And this is the basic mechanism by which something like finasteride or dutasteride, which inhibits the conversion of testosterone to dihydrotestosterone by even more, by over 90%, can increase estrogen in the body. So by how much can finasteride increase estrogen in the body? Well, first of all, studies have shown that finasteride can increase serum testosterone levels by approximately 10 to 20% on average, right? So if somebody's baseline testosterone level is 500 nanograms per deciliter, 10 to 20% increase is going to put them around 550 to 600 nanograms per deciliter, which is not a huge amount of increase, right? It's not anywhere near an increase that you can get from something like, manually dosing testosterone or TRT or anything like that. Now, when it comes to estrogen, along with the increase in testosterone, estradiol levels can also rise by about 10 to 20% as a result of the increased aromatization of testosterone to estrogen. So basically, if somebody takes finasteride, that inhibits the amount of testosterone converting to DHT, thus increasing the testosterone a little bit, maybe 10 to 20%. Since testosterone converts to E2 or estradiol, and that increase will equate to an increase also in the levels of estrogen. But it's not going to be a huge increase, right? Because still 10 to 20% increase in testosterone, it's not a humongous increase. So if somebody's basically estradiol levels is 20 pg per ml, and 10 to 20% might raise it to around 22 to 24 pg per ml, right? And how much basically of the testosterone is metabolized into DHT or estradiol, E2? About 5 to 10% of testosterone is converted to DHT, and for estradiol, for E2, about 0.3 to 0.5% of testosterone is converted to estradiol or E2, the most potent form of estrogen, right? Because there are three forms of estrogen. There is E1, there is E2, and there is E3. E2 is the most potent, and it's about 80 to 90% of total estrogen. Then you have E1, which is about 10 to 20% of total estrogen, and E3, which is minimal levels, right? So basically, these are the main numbers when we talk about the conversion, or by how much does finasteride raise testosterone, and by how much with that increase in testosterone equate to an increase in E2 or estradiol levels. You can see it's not a humongous amount that you would get from dosing finasteride, and of course, the more you inhibit testosterone, the more you're going to convert a little bit of that to estrogen, and hence this is how you understand when we talk about finasteride or dutasteride, and they say that one of the side effects of it can be gynecomastia. That is a direct result from the possible increase in estradiol or E2 in the body. That's where this side effect comes from. So at the end of the day, everything has to be tested. So once you get your blood tested, and basically you get all your testosterone panel, your estrogen, you can see after a specific dose of finasteride how much did your estradiol E2 increase, and then you can adjust accordingly. And I just want to mention something is that, there are some things that you feel with if you take finasteride, which is like the overall smoothness in the body and smoothness in the muscle that you get when you take finasteride. And you can say, because it inhibits DHT, which can have an effect on muscle hardness and muscle and the dryness of the muscle. But I suspect that it also has a lot to do with that increase in estrogen, that smoothness, and that a little bit the layer of kind of like a watery layer that covers your muscles that you feel when you take finasteride or 5-alpha reductase inhibitors. I think definitely there is a big probability that the rise in estradiol has something to do with that. Not to mention, of course, the decrease in dihydrotestosterone and all of its effects on the body. So that being said, in this video we shed some light on finasteride and dutasteride as far as its effects on estradiol. And I'm going to be exploring these hormones in detail in upcoming videos to be able to better optimize and maximize our human bodies as a part of the perfect human program.